Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Throughout the pandemic, Mary Washington healthcare leadership has been committed to keeping our community informed. Tonight, we are here to share what we know about COVID-19 in our region and what we can do to keep everyone safe and healthy. During the town hall, you will hear from expert panelists, and we welcome you to ask questions in the chat during the conversation. So let's go ahead and meet our panelists. First, we have Dr. Mike McDermott, our Chief Executive Officer. Second, we have Dr. Sheena Taylor, Chief Hospitalist. Third is Eileen Doman, Chief Nursing Officer. And last but not least is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer. Dr. McDermott, I'd like to turn it over to you to tell our viewers the latest information regarding our region.
Thank you, Lisa, and thanks to all the members of the community for tuning into our Facebook town hall. We wanted to have another one of these. Some things are changing here in our region. Wanted to bring everybody up to speed with what we're seeing here at Mary Washington Healthcare, what we're seeing regarding COVID-19. I'm bringing up our graph that most viewers of our town halls are probably familiar with. Currently, we have 68 inpatients that we're treating that need inpatient hospitalization to help them battle COVID-19 between Mary Washington Hospital and Stafford Hospital. The graph that's up in front of you, remember, on the left side of the graph, that's at the very beginning of the pandemic back in March of 2020. And then there's a little space on the yellow line there for every day since the beginning of the pandemic, all the way to the right side of the screen, which brings us to today. And that yellow line shows the number of inpatients we've had in our hospitals every single day of the pandemic. You can see right in the middle of that graph, there's a big peak back in January of this year when we had 100 patients that were hospitalized. But over on the far right side where we are today, we're up approaching that. We're up at about 70 inpatients. There's a red line buried in there too that I want to bring everybody's attention to, because that red line is the number of patients we have in an intensive care unit at any point in time. And when you look at the experience here in the past week or so, we are at the highest level we've ever been in the pandemic. And that is what is very, very concerning. So the acuity of the patients that we're caring for is very, very high. And it's putting a tremendous amount of pressure on our health system. The pressure is so high that it's affected our ability to perform scheduled procedures for patients who need to come in to have a surgical procedure or another procedure performed where they might need to be hospitalized. We're now needing to delay some of those so that we can create capacity in our system to care for the patients under our care in the emergencies that are happening every day. And so that's why we wanted to get back together with our community and talk a little bit about what we're seeing with COVID. There's another graphic that we've been sharing on Facebook that I think is very telling. And that graphic talks about really the benefits of vaccination against COVID-19. And so this is our experience, 68 inpatients. You can see the unvaccinated individuals, they're represented with the yellow stick figures in the graphic. Vaccinated individuals that we're caring for COVID-19, they're represented with the green stick figures in the graphic. And so of those 68 inpatients, 62 are unvaccinated. In fact, every single patient in our intensive care unit and every patient on a ventilator is unvaccinated against COVID-19. You can also see the breakdown there. We're now caring for more inpatients that are under the age of 65 than we are above the age of 65. And all of those under the age of 65 that we're caring for are unvaccinated. All of this could have been prevented by a simple vaccination against COVID-19. These vaccines are very, very effective against COVID-19. I know I hear some people in the community talk about how, hey, if you get vaccinated, you could still catch COVID. There are some breakthrough infections, but the vaccines, you're not just one time, twice as unlikely to catch COVID-19, 3 times as unlikely to catch COVID-19, 4 times. That sounds pretty amazing, right? I'm 4 times less likely to catch COVID if I'm vaccinated. 5 times. You're over 7 times less likely to catch COVID by being vaccinated than if you're unvaccinated. These vaccines are still extraordinarily protective against contracting COVID-19. And then if you do happen to contract it, your risk of serious illness is significantly less if you're vaccinated because your body has already been primed to be able to fight the virus. And so I encourage everybody, if you care about anybody in this world, right? If there's anybody that you love, a family member, children, a spouse, Parents, if you love anybody, vaccinate yourself to protect them, okay? It's the best health decision that you can make at this point in time. Get vaccinated against COVID-19. Protect not just yourself, but every single individual that you love.
Thank you, Dr. McDermott. Some of our patients, you had mentioned this, that some of our patients may have had a scheduled procedure recently postponed or rescheduled. Can you give a little bit, can we get a little more detail about that decision to postpone, how long we expect it to happen, and what kinds of cases we've decided to postpone?
I can speak
Dr.
a little
Newman?
bit to that. Yeah.
Thank you.
So, our healthcare system is currently at capacity. We have no ability to take care of additional people. We're really stressed. Our healthcare teams are working tirelessly around the clock to be there for our community, in our emergency room, in our intensive care unit, and throughout our hospitals. But this is not just a Fredericksburg problem. This is not just a Mary Washington problem. Eileen and I were on a call with state leaders last week across the state, healthcare officials. Every single region in Virginia right now is maxed out. So if somebody at a smaller hospital has something where they need to be transferred to a larger hospital, there is not that capacity. There's very, very limited capacity. Some healthcare leaders were talking about transferring patients hundreds of miles for care to Pittsburgh and Philadelphia and some other large population centers outside of the Commonwealth for care. So this is a very serious issue. This is not just about COVID. This is about anybody coming to our health system that needs care and being there for them, and for us being able to provide care if you had a car accident, a cardiac problem, anything, a stroke. So what we've had to do to have some capacity is limit surgeries for which afterwards you would need to be hospitalized. So scheduled surgeries. These are not elective surgeries that you really want to delay. And those are the concerns. These are individuals who need heart surgeries. These are individuals who need cancer surgeries and others. And right now we've put a 2-week delay on those. And we have a group of our medical staff, anesthesiologists and surgeons and medical staff leaders, looking at each one of these cases and the safety of being able to put that procedure off a week or two. But it's all highly concerning, and really unvaccinated individuals in our community are creating this bottleneck, not only here, but throughout the state. And they're preventing all of us having access to healthcare or the capacity to access healthcare. So at this point, we put a 2-week sort of moratorium on elective surgeries. We are looking at each one of those surgeries that's being rescheduled for safety. Medical staff leaders are looking at those, and we'll continue to reassess as we look at our capacity. But we have no ability to transfer patients outside of our health system to anywhere else, because nowhere else has that ability to take them.
I think that's a key point, Chris. The unvaccinated individuals in our community are creating a crisis in healthcare for everybody, the vaccinated and unvaccinated, who might require emergent care. And so, vaccination, everybody thinks it's a personal choice, but it's not. Those choices are affecting the healthcare of everybody in our community at the current moment. And vaccination is a routine public health requirement in a civilized society. If we all want to enjoy the benefits of living in a civilization, going into grocery stores with one another, we need to protect ourselves, if we can, against contagious diseases, especially life-threatening contagious diseases like COVID-19. And so everybody needs to get vaccinated. We need to do it for one another's sake, for the health and safety of everybody in our community.
Now, part of the conversation we just had, Dr. Newman, about scheduled procedures, you referenced capacity constraints. Can you explain what we mean by that?
Yeah. So there's actual beds. So we have so many beds within a health system with the ability to take care of people, but all beds are not the same. Some of our beds are for labor and delivery, and for pregnant women to deliver children. Some are for pediatric patients. Some are for neonatal intensive care unit patients. So your typical adult patients require a certain level of care. We only have so many ICU beds. We only have so many med-surg beds for people with medical issues or surgical issues. So that's one part of it, and that is already being strained to the max. But on top of that, There are highly skilled and highly educated medical professionals required to care for patients when they're in those beds. I'll just say an ICU nurse, it takes years of education, training, and experience to be a competent ICU nurse. When you walk into our intensive care unit, patients are on complex drips with medications, they're on ventilators, a lot of complex things going on in the care of those patients. It takes a highly skilled individual to care for those. So, and there's only so many patients with all those kind of drips and a ventilator, all that a single nurse can safely care for, or a single respiratory therapist can safely care for. So that is also creating a significant bottleneck. I think Eileen can speak to this, but already a year and a half into this pandemic, with and this is really the hardest portion of the entire pandemic for our healthcare system. A year and a half in, a lot of individuals are exhausted. They've been working tirelessly for a year and a half. If you think to those disaster movies, where there's an earthquake or a mass casualty and the chaos in a hospital, but that's a day or two or three, and people rally and they're able to care for their community. This has been relentless for month after month after month. And the unnecessary death that we are seeing from unvaccinated individuals on a daily basis is also taking its toll, causing moral distress. And really, it's a traumatic situation for our caregivers to see. And we're not talking about people at the end of their lives, elderly, that it was stereotypical at the beginning of this. We're talking people in their 20s and 30s and 40s now in our intensive care unit who are dying and who are requiring very high levels of care and are very ill. So all these things are adding up to strain the entire capacity of the healthcare system throughout the entire state. Eileen, I don't know if you can speak also to what our staff is going through on a daily basis. But.
Oh, without question, Chris, this is the hardest part of the whole pandemic that we've been through. In the beginning, it was you rallied together because something has happened, and no one ever thought that we'd be, 18 months later still talking about it. Those very same nurses that took care of the very first COVID patients that we've had are still now taking care of COVID patients, yet they've seen hundreds of COVID patients come through their beds, and now taking care of sicker COVID patients, and now they're younger. And to know that those are unvaccinated patients, that this could have been avoided. Just the stress and the pressure, and you're right, the moral distress for nurses, for respiratory therapists, for all of our clinical staff and all of our providers. It's hard to feel like you're making progress when it just keeps coming at you, and you just don't feel like there's an end in sight. So I would say without question, this is the hardest part of the pandemic. And early in the pandemic, there was lots of community attention and signs and parades and whatnot. This has been a long slog. It's a long time. People are tired. They're exhausted. They're not only dealing with what they're dealing with at work, they're dealing with what they're dealing with at home, concerns about their children and what's happening in the in the community. It has to stop. And knowing that we have something that could end this, that could get us to that herd immunity if people would just be vaccinated.
Thank you, Eileen. And you talk about the pressures on the staff when our house is full, when the hospitals are full. There's pressures on our patients too. And we recently decided to change our visitation parameters slightly to help with that. Can you talk a little about the decision to change our visitation and where we are right now with that choice?
And our community knows, and we all know, we've been back and forth about visitation throughout the whole pandemic, trying to make sure that we keep our buildings safe, that we have people in the building, that we know who's here, and so limiting access. And what we find is that when we limit visitors that are able to be with their loved ones, that actually doesn't help care. It makes care more difficult. When people are at their most vulnerable and they're sick, they need their loved ones with them. As a caregiver, as a nurse, I want someone to have their loved one with them. It makes care easier. And so even though we're at some of the highest numbers that we've seen and everyone is very tired and exhausted, we really needed to take a pause and sort of pivot and say, what's really the right thing to do for the patient? And the right thing to do for the patient is to do whatever we can to make sure that at least one loved one can be with them during that hospital stay. So that's the change that we've made just this week, is for patients that are in our hospital, in our regular med-surg areas and critical care, is we're allowing one visitor, one designated person that can visit during the hospital stay. Our visiting hours are limited from 12 to 8, but that person can come and can be here and be with that patient. It helps the patient, it helps the family, the loved ones. It actually helps the care team to be able to be more effective, because we can talk with the patient and their loved ones. And many times when patients are stressed, it helps to have a loved one with them and another set of ears that can hear, what the care team is saying. Now, in our emergency department, we're allowing that one designated visitor also. That's obviously 24/7, because patients come into the ED at all hours of the day and night. But there's a caveat to that, is that as we're seeing so many more patients coming through our emergency departments, we can't have our waiting rooms filled with patients and with their loved ones. So it could happen that if you come to our emergency room, if our waiting rooms are full, we may ask you to wait and bring you back and bring you in with the patient, when your loved one is actually being seen. For our patients under the age of 21, so pediatric, we are obviously allowing a parent or a guardian to be able to be with them during the hospital stay, and they can switch off. That can be 2 different guardians, only one at the bedside at any one time. And then for our new moms that are coming in for a wonderful event of giving birth, we allow them to come in with their birth partner, and if they have a certified doula, we'll also allow the doula to be in. So we're trying to do what we can to really enhance the patient's experience when they're in the hospital. But it is a juggling act, and it is hard.
Thank you. And we're getting a ton of questions already about boosters. So I'd like to switch over to that for a minute if we can. The CDC came out with those guidelines for vaccine boosters just recently. So can one of our panelists talk about the guidelines and who should or may be getting a booster shot?
Yeah, I can speak a little bit about, on a high level, who should be getting a booster shot. So really 2 categories. One is those who should get the booster, and others are those who may or are eligible. So in the should category, anybody over the age of 65 who's had and this is only the Pfizer vaccine, so that's been approved. So for the Pfizer vaccine, anybody over the age of 65 beyond 6 months after their second dose should get a vaccine, a booster. Also who should, and that was approved prior to this, is anybody with an autoimmune deficiency or an autoimmune condition. The other in the should category is anybody over the age of 50 with a pre-existing condition that's more than 6 months out for their shot. In the may category, or who would be eligible and may get a booster shot, are those over the age of 18 to 50 with pre-existing conditions. And then many people with, I'd say, at-risk jobs who are really could be exposed to COVID. That includes healthcare workers, those that may work at prisons, teachers, a lot of frontline staff, including grocery workers and others, are in that category. And they may receive a 3rd dose if they're beyond 6 months from the Pfizer. They are deliberating now on Moderna, so that has not been decided right now, and Johnson & Johnson, which would be a 2nd dose as a booster, not a 3rd dose.
And where would somebody get a booster shot? We're getting questions about whether we would open up our clinic. We had that great clinic at the Fix Center early in the opportunity to get vaccinated this year. But where would somebody go ahead and get that booster?
Yeah, so at this point, we're not planning to have our large vaccine clinic, and that's for several reasons. Number one, when we had that early in the pandemic, we were the only way to get that vaccine. We had the supply of vaccine, and we wanted to make sure that we could get that out to the community as quickly as possible. Now the vaccines are very readily available. Most pharmacies, anything from Walgreens to Wegmans, CVS, they all have them. Many of the physician practices have vaccines, so there's just a lot of areas, and you can go vaccine finder, online, and you can find the nearest and most appropriate for you. The other, as we talked about, was staffing. It was extraordinarily staff intensive. We had a lot of individuals working that clinic, including many healthcare workers, nurses, physicians, and others that we need every hand deployed to the hospital at this point. So we have to really hone our resources in to where we need them at this point.
So we would say that if somebody is in that should category and they're 6 months out or more from their Pfizer vaccine, that they can go ahead and do it. There's no
That's right.
reason to delay.
That's right.
Thank you. So some of our community members have commented that our staff shortages that you're talking about, Dr. Newman, are directly connected to the vaccine mandate that we've announced at Mary Washington Healthcare. Is this accurate? Eileen, I see you shaking your head. Can you answer that?
Absolutely not. We've been challenged with staffing now for a period of time, just like every healthcare system across the country. Demand is very high. And so we've been challenged and certainly seeing that heighten now. We've seen the large majority, a large number of our associates have gotten the vaccine. And we have had some people resign over the requirement to be vaccinated. But every healthcare facility is requiring it. It's been a mandate that's come from the federal government. So working in healthcare, you have to get the vaccine. It's a requirement for all of us. So we're not asking our associates to do anything more than what the federal government is asking or mandating is happening within healthcare systems. You know, we have a responsibility to our community to keep them safe. And we need our healthcare workers here taking care of our community. So the reason why we want people to be vaccinated is we want them to be safe. We want this to be the safest place that you can work as a healthcare professional is here at Mary Washington Healthcare, because we put your safety first. And so that's where the requirement comes from. And we're not alone. Every other health system, and we've spoken with other health systems that have had the requirement before us. And I hope that we don't lose many associates. It's not looking like that will happen to us. And I hope that everyone would reconsider and think about that requirement, and that it's a privilege for us to be healthcare professionals. And we take our roles very, very seriously. And right now that includes being vaccinated.
Yeah, everybody talks about, everybody likes to talk about those who might choose to leave the healthcare workforce because of a requirement. But remember, it's a very, very tiny minority, less than 1%, right? And almost all of our caregivers are happy to be vaccinated. They want to have the safest care environment that they can have for our patients and a workplace with one another. And so I would make an appeal to any nurse out there or anybody who's listening tonight, a healthcare provider who maybe took a pause in their careers during the pandemic. It's been a tough time. There's been a national shortage of the healthcare workforce because of the tiring effects of the pandemic over the last year and a half or more as we enter into our third winter with COVID-19 around. I would appeal to them and say, hey, come on and join our team. I would ask you to come join our team. We've been leaders in proclaiming our safe workplace, right? And our safety that we want to have for every single patient who's under our care, that sacred duty that we have for safety. So I would make an appeal. If you're a nurse or a healthcare provider out there, come join our team. We're a great team to be a part of. It's a very rewarding work, helping patients in our community at their time of greatest need. And we are committed to not just the safety of our patients, but to the safety of our care environment for our workforce as well.
Lisa, I just wanted to comment as well on, the fact that we are moving towards vaccination for all of our associates within the organization, and we're opening up that visitation. There's a trust that we're extending to the community there. We're trusting that you're doing the right thing. We're opening our doors because we want our patients to have loved ones that are there to care for them, much like what Eileen is saying. But we're trusting that you're not sick, and we're trusting that you're not going to be around or be involved with our patients who are at extremely high risk at that point in time and dealing with a multitude of illnesses. We're also trusting that you would be vaccinated. And so what we want to avoid is, although we're not mandating that any visitor be vaccinated, we really encourage it. We would really want you to avoid, if you're not vaccinated, to really allow for that loved one to receive the care that they need to receive in a space where that's completely vaccinated, as we're doing, and not introduce that risk at such a critical time.
Thank you for that. We did have that question about whether we were requiring it, so I appreciate you covering that. we're getting some questions about treatment for those in our care. Some have explicitly asked what treatments do we use, which can be a pretty broad question. And then we've also had some questions about monoclonal antibodies. So let's start with how do we care for people who have COVID-19? Is there a magic pill, Dr. Taylor?
Dr. Taylor, I'll let you take that one.
So there's no magic pill. There are treatment algorithms or treatment pathways that we abide by here within the organization. Those are all evidence-based practices that are tried and true by our amazing infectious disease team as well. And not to bore anyone with all of the logistics behind it, but generally there's a stepwise fashion. What we will say is, unless you're requiring any kind of oxygenation, generally you can probably be monitored at home. And one of the reasons for that is just the sheer volume, right? So now we have so many members of our community that are on the higher severity risk scale that we have to make space for them. And a lot of organizations, and I'm sure we've all heard it in the news, there are a lot of organizations and healthcare systems that are having to unfortunately do even more extreme home monitoring. Luckily, we still have the monoclonal antibody, and we've been really pushing that forward, and that has done some tremendous work for us in kind of trying to reduce the risk in those highest risk populations. But we still have struggles with our volume, and so unless you're requiring oxygenation, you're probably going to be monitored at home. Those that are requiring oxygen, we do have treatments that would be specifically for those patients. And then, of course, there are some that require ventilation and things of that sort. I did see some questions around home remedies of COVID and how to home remedy a COVID infection. Your home remedy is to stay in isolation and really just to make sure that you're not giving it to anyone else. And much like any other infection, staying hydrated and things of that sort is really important and just treating the symptoms. Definitely encouraging, if you're having any kind of severe any shortness of breath, definitely coming in and being evaluated. But we always want to leave the plug that if you are questioning whether or not you do need to be evaluated, we do have the resources through our hotline here with our nurses to help you evaluate that, make that decision.
Lisa, I see a few questions here on boosters, as you're showing the link here. Just want to take those quickly. So the booster is only for Pfizer at this point. It's only for those who received the first 2 doses of Pfizer. It's not for Moderna or Johnson & Johnson yet. There are ongoing studies about mixing the vaccines. So there are studies about those who had Pfizer getting a third Moderna, or those who had Moderna getting a third Pfizer, and if that's better. We don't have the data on that now. That is not known, but they are looking at that at this point. I think those were the two big ones. So this is really only for Pfizer, and mixing vaccines is not recommended at this point.
There's some questions about monoclonal antibodies, and although it is a treatment for high-risk individuals that have contracted COVID, like the monoclonal antibodies are also have risks associated with them, a higher risk profile than getting vaccinated does, for sure, right? And you already have COVID at that point in time, which is very concerning, and they're not perfect. It's not a cure. The monoclonal antibodies are not a cure. They do lessen a risk for high-risk individuals, but it's not an absolute cure. And there's also a question in the chat about a shortage. There was a national shortage of the monoclonal antibodies last week, where there was more demand than there was supply. And so there was that whole scarce resource evaluation going on. It could not be given to everybody. And in the state of Virginia, we had limited supply. There was more demand than the supply that the state of Virginia had as well. And so there's plenty of supply of vaccine out there. And so everybody, if you're not vaccinated, you really have a duty to go get vaccinated to protect yourself, protect anybody that you love, and protect society as a whole at this point in time.
And now there was one specific question to Dr. McDermott about the monoclonal antibodies and whether we were prioritizing unvaccinated over vaccinated. I don't know if Dr. Newman, you know the protocol best on how somebody is eligible for monoclonal antibody, and I've never seen vaccination status as part of that. Would you be able to speak to that?
That's correct. At this point, that is not one of the criteria that we are looking at. That may come to pass though, because as we saw, people who are vaccinated have a far lower risk of requiring hospitalization than those who haven't been. So there may be issues where, or with the supply being such that it could be limited against vaccinated people, but that is not occurring at this point. It is something that HHS is now distributing to the states because this is a scarce resource. And, it's really, quite honestly, perverse about this is many low vaccination states that had really became overwhelmed with the Delta variant really began utilizing their individuals who were anti-vaccine that started pushing the monoclonal antibody. Monoclonal antibody is a great treatment. We were sort of one of the first in the state to push that. I'm very proud of that, and we've saved many lives with that. This is no substitution to vaccine. It's truly a perversity to do that. I mean, why wait till you're sick? This is a this is a labor intensive. It requires nurses. It's a complex infusion. Get vaccinated. It's really strange that this has become such a thing, but it's being pushed, and the supply subsequently got wiped out, and we're trying to catch up with that at this point.
Thank you for that clarification. We're getting a mix of questions that I'd like to kind of bundle together into this discussion of natural immunity versus vaccine immunity. So there's a series of questions about, efficacy, length of time, all of this about natural immunity if you've had COVID-19. Can we talk a little bit about how that all works and whether, even if you've had it before, should you still be considering vaccination, all of that?
First of all, there's no reason not to get vaccinated. If you've had COVID, you have natural immunity, you don't have natural immunity. I feel that there's a population out there that's looking for any excuse not to get vaccinated. That would be, oh, I'm young, it's not going to get me sick, or I've had COVID and I have natural immunity, or I can get the monoclonal antibody if I get sick. There's just excuse after excuse of why not to get vaccinated. I'm not going to debate that there is some natural immunity if you've had COVID. That is likely true, but it's not as reliable as a vaccination. We know how the vaccines work. We know how they protect you. I'll just give an example. The initial Wuhan strain that came about, individuals who got that had really no natural immunity towards the South African variant when it came about. The vaccines really provide superior immunity across the board. It's something that we can understand. There's no reason not to get vaccinated, even if you have quote unquote natural immunity. There is some evidence that the Delta strain, if you've had COVID before, you do have some natural immunity, and I'm not going to deny that. But again, there is absolutely no reason not to get vaccinated, even if you've had COVID in the past. In fact, that's the recommendation and the safest thing to do for you and your family.
Thank you. We're getting some questions about the booster again, the third shot versus booster. I think people are using those interchangeably. Are they the same? Is the booster just a third shot of the same level of vaccination?
Yes.
Okay, and I am seeing this is posted twice. If ECMO is available at MWHC, I have to be honest, I don't know what that stands for.
Yeah,
so,
that is something we do not offer that at Mary Washington at this point. In fact, it's a very limited resource throughout the state. It's for people who are in very, very critical condition to really oxygenate their blood because their lungs are no longer working. So it's a very high level invasive treatment offered at very few hospitals in the state.
Is there any reason to think that the third shot could be harmful if somebody's antibody level hasn't waned after receiving their first 2 doses?
There's no evidence of that at this point, both in U.S. trials, where they've done it, as well as looking at Israel, who started the booster shots a while ago. So we were able to look at that data as well. There's no evidence. In fact, even side effect profile appears that people have about the same or less side effects than they do after the second dose that they've previously had.
We've had some questions about pediatric patients, whether we're seeing an increase in pediatric patients with COVID-19 needing hospitalization.
Not necessarily needing hospitalization. As I said before, the Delta variant doesn't get children more sick than the other strains have. The problem is it's much more transmissible amongst children than the previous strains have been. So a large volume of children have gotten COVID across the nation. And as a percentage, more of them have required hospitalization and higher levels of care. I've seen quoted roughly about 0.9%, 1%-ish of children who get COVID do require hospitalization. That's been pretty stable throughout the entire pandemic, but so many children are getting this Delta variant that it is straining children's hospitals and other pediatric providers and their resources.
We do have a question here about how we're prioritizing beds. Can we talk a little bit about that? The question specifically says if cardiac or cancer patients have been vaccinated, why aren't they given priority for available beds versus unvaccinated COVID patients? Can we talk about how people are put into our hospital beds?
Sure, with over 30% of our admissions coming through the emergency department, there's actually federal laws that say that we have to take care of everyone that comes to our hospitals. We have to provide care, we have to stabilize them. And so we don't get that ability to say yes to you and no to someone else, as we do have that responsibility. Once a patient comes to our emergency department, if they need to stay, then we prioritize them for an admission. And usually the patient's condition is what really is dictating getting the patient to a bed and the availability of that bed. So if this is a patient that needs the ICU, we need to get them to an ICU bed. If our ICU is full, then, and we don't have the ability to transfer them someplace else, then we need to take care of them. And so really to be able to say we could differentiate vaccinated versus unvaccinated, that legally we're not able to do that.
There are also ethical principles involved here for providing care to every single human being who needs care, right? And that's what we do in healthcare, right? And we could be frustrated that these individuals had an opportunity to make a choice that might have decompressed our system. And I think that's some of the frustration that I think we're voicing today, is that we have a very simple solution here. We live in a civilized society and we all have requirements with one another for public health and safety that we should do to be part of that civilization with one another. And so when some individuals don't do that, we can be frustrated. The additional frustration here is that those individuals, when they come in with an infectious contagious disease, place others at risk and place our care team at risk. And that's what's a little unusual about this, as well as those individuals and the choices that they're making are also increasing the risk for our care team and others. And that can be frustrating, but we will care for every single individual that comes into our health system here at Mary Washington Healthcare.
Thank you. There may be some confusion when talking about postponing procedures versus available beds, that it's a complicated process, like you said, of prioritizing and ensuring everybody gets the care they need.
This is the frustration that it's not just Mary Washington Healthcare. I want to make sure that's clear. It's every single hospital in the state of Virginia right now. It's hospitals across the country are facing this crisis level, right, where our ability to care for everybody who needs care, which we usually can accommodate every single day, is now being strained, right? And things are starting to break down a little bit, and we're not able to care for every single person on every single day like we traditionally can. That's what's frustrating, and it's within our control, our society's control, to be able to get back to that sense of normalcy now. Right, then the vaccines play a role there. That graphic again that we show, that shows the number of unvaccinated folks that are putting this strain within our hospitals. It's clear if they were vaccinated, and over 70% of adults in Virginia now are fully vaccinated, right? And you can see the difference in that graphic, the number of yellow stick figures that we have. That's coming from the unvaccinated minority of adults in the state of Virginia. So we can control this, right? The data is the data. It's showing what it is. There's some other question. Another question I wanted to just mention and talk about. People are saying, like, why do I need a booster? This is showing that the vaccines don't work. Look, it's only been 8 months, and they're talking about needing a booster. And the analogy I use is it's like a memory, right? And this is the vaccines. And this has to do with the safety of them too, and the long-term effects. Is the vaccines are a sugar molecule, right? Is what they are, a very fancy designed sugar molecule, and it shows your body a picture and it says, hey, if you see anything that looks like this, be on the lookout. It's like a memory, right? You show somebody a picture. 8 months later, if I show you that picture, will you remember it exactly? Well, your memory might fade a little bit. And so what we're saying and what we're showing is that, hey, when we showed you that picture 6 months ago with the 2 vaccine doses, we're seeing now memories are fading. And so we'd like to show you that picture again, be on the lookout for this, and your body creates the antibodies to be ready again. And so it's not unusual. It's why we get flu vaccines every single year and other sorts of things for respiratory viruses, that our body loses memory a little faster than some other type of viruses. So not unusual. But the good news is we can show our body that picture again and get prepared, right? And boost up that memory again. And that's what the boosters do. And it's been shown now that with the Pfizer vaccine, it's appropriate for those individuals like Chris stated earlier. And, I do know that the CDC is looking at the role of boosters from Moderna and the Johnson & Johnson vaccine as well.
I see a question here, Lisa, about the field hospital. I know there's been a lot of interest over the entire pandemic. We are using the field hospital at this point. We are now using that for monoclonal antibody infusions. We are doing so many of those, upwards of 150 infusions a week, that we needed that large facility in order to safely care for those individuals. And again, I just want to reiterate, when we look at capacity of the health system, this is not just space. It's highly skilled providers that we need to care for individuals. So the field hospital, unfortunately, doesn't solve that. We need doctors and nurses and respiratory therapists and CNAs and anesthesiologists and many, many other parts of our care team, pharmacists and others to care for everybody.
We received a question of whether we've seen any hospitalized patients or severely ill who had previous case of COVID-19. Is there a chance that there's repeats, people who have had it before getting it again?
The answer is yes. So yes, we have had individuals with that have been reinfected with COVID and severely so. So that has happened.
There's a question here. It says, if you're overwhelmed, why are you firing people? I just want to be clear about this. It's like we are absolutely committed to safety, right? And being a high reliability organization, right? And creating the safest work environment that we can for the patients that are under our care, many of them immunocompromised, right? And not able to even protect themselves with a vaccine dose because they're in an immunocompromised state and can't mount the immunity response, right? And we have a lot of healthcare providers here that we need to be able to show up every single day to care for our community. So we need a safe environment for our workforce as well. And so our vaccine requirement and our policy for that is centered around safety, right? And we will not sacrifice that safety for any reason. And so there may be some individuals who are not willing to abide by our policies. We have lots of policies. We've had a required flu vaccination policy that pre-exists this, right? And so this isn't controversial. We have lots of vaccinations that we require for our healthcare workforce, a whole host of them that you need to be protected to be able to work here for the sake of our patients and for the sake of one another, right? And so this is not unusual, and we're not just firing people, but we are absolutely committed to the safety of our patients and the safety of our care team.
Thank you for that clarification. And do we know what % we need to reach to get herd immunity? We've talked about this early in the pandemic, but things have been changing. So is there a number, a magic number?
I mean, it's a combination of people who have some sense of immunity and as well as the prevalence of the virus in the community. And so what's not helpful right now is the wide prevalence of the Delta variant, especially among the unvaccinated in our community. That means there's lots of virus around, right? It's more helpful when the overall prevalence is lower and you have other individuals with some semblance of immunity. And so there's no perfect number, there's no magic number. It certainly would be helpful if there was less prevalence of the virus in the community. One thing that is leading to that high prevalence is how rampant coronavirus currently is amongst the unvaccinated population. That's not helpful to achieving any semblance of herd immunity.
And also, the more infectious or contagious a pathogen is, the higher you need to have a percentage of people have immunity for it to be, you get to that quote unquote herd immunity. So the Delta variant is far more contagious than the previous strains of COVID. And subsequently, those old numbers they were talking about, 70%, are nowhere near accurate because of how infectious Delta is and how prevalent, as Mike said, it became in our community.
Right. That brings up the point that we're dealing with is when we keep giving this virus an opportunity to mutate, we give it the potential that we have to start back from zero. And so the concern from a lot of the healthcare community is the potential for further mutations and where that can harm us. If you can say, luckily, the Delta variant, we still have some efficacy, and we still have a tremendous amount of efficacy from the vaccines that we have now. But for those members of our community that are not getting vaccinated, what they're doing is creating an environment that is suitable for this vaccine to try and mutate again and become stronger. So it's really it's a race against time. And so if you haven't made the decision, there's no more time to wait. We need you to get vaccinated now. Our society, our world needs you to get vaccinated now.
And, there is that question of, why so soon do we need to have a booster? Some other things like the flu shot, which has been around a pretty long time, you only have to get once a year. Why is this different?
There's differences between a coronavirus and an influenza virus and a measles virus and a chickenpox virus. Those viruses are all different. They're not every virus is identical. And unfortunately, the coronaviruses, a lot of them which cause the common cold and other sorts of things, we know many people can get reinfected with those over a period of time. The body doesn't mount long-standing immunity against coronaviruses and those sorts of things. That's a challenge. But remember, we get flu shots every year as well, based on the strains that are coming around as well. So I don't think there's anything unusual here. I think we're all very fortunate that we have vaccines available to protect us against this coronavirus that is so prevalent right now and has been causing this pandemic in our society really for over a year and a half now.
And you mentioned the flu shot. It's come up a couple of times. It's kind of that time of year. So can people get the flu shot and the COVID-19 vaccines at the same time?
You can, absolutely. You can get them co-administered at the exact same time, right? There's no contraindication to that. And I encourage everybody out there to get vaccinated against influenza. Let's keep the flu season low this year. That's very, very important for us as well. And if you're not vaccinated against the coronavirus, please get vaccinated as quickly as possible.
Thank you. And, do we know if COVID vaccinated people can spread COVID? Is that a possibility? I hear that a lot on social media, that debate of whether or not we can transmit.
If you're a vaccinated individual that has a breakthrough infection, you can have a viral load that does allow you to spread it to others, right? But remember, you are 7 times less likely to catch COVID if you're vaccinated than an unvaccinated individual. So you're extremely protected. But yeah, there are some cases where that can occur, right? But you are extremely well protected, as well protected as you can be if you're vaccinated, right? Nothing is perfect, right? If you use an umbrella out in the rain, you still might get some raindrops on you, but you sure would rather have that umbrella up, right? You're much better protected, right? This is a similar analogy to masks as well. It's like, well, masks aren't perfect. You can still catch it. Like, yeah, you can. But you know what? It's that umbrella analogy. If you have an umbrella up in a rainstorm, you're much less likely to get wet, right? And so it is protective. Nothing is perfect, right? You still might get a little wet, right? It could happen, but it's much better. I think everybody would rather have the umbrella than not. That's what the vaccines provide. It's what the masks provide. It's why everybody should be out there to get vaccinated. It will lower the prevalence of coronavirus. It'll help us be able to move forward to some semblance of normalcy.
Well, thank you. I think
there about the flu vaccine being different than this experimental shot. And I remember, I just want to state to people, this really is a sugar molecule, right? And it's in your body, and then it is broken down and out, just like I'll use the analogy like a gummy bear you eat, right? Is anybody worried about the long-term effects of a gummy bear you eat like 20 years down the line? It doesn't even make sense, right? It's not how your body works, how the metabolism works, okay? And so it's this sugar molecule, right, that is given to your body, very fancily designed, shows your body a picture, right? Your body's able to mount an immune response to it. Then it is broken down and it's gone, like other molecules in your body are. And that's how it works. And so these have been given to billions of folks in the world now, right? Extraordinarily well studied, right? Like we have tons of data. These are extremely safe and very effective, right? They really are a miracle of modern science. And so, this whole thing about long-term effects, no, it's like these are really, really extraordinarily safe vaccines, extraordinarily safe.
Yeah, and there's a lot of emphasis on those that are, concerned about vaccine, about what may happen to be years down the road. As Mike says, that makes no sense. It's not even a real risk. We do know that 10% of people who have COVID, even mild COVID, are still having long-term effects, brain fog, decrease in memory and mental acuity, chronic headaches, chronic pain syndromes, respiratory issues, many other things. That is not theoretical. That is happening in real time. If you survive, if you don't have a very severe case, people are going on to have long haul symptoms. And when you think of the tens of millions of people in the United States who've had COVID thus far, 10% of those individuals is a large number of people. We're talking millions of people in the United States right now are suffering from COVID long haul. And we don't have any treatments for that. At this point, we don't know how long those people will be disabled or suffering. So this is, it's a theoretical, problem of what could happen down the road versus reality.
We have time for a few more questions here. Is it safe for pregnant women to get the booster? We've already talked about pregnant women, it being highly safe to get the vaccine to begin with, and we highly encourage it. Can we cover that?
I honestly don't believe, I have not seen any data on the booster in pregnant women, so I don't want to comment. I like to be data driven when we make recommendations here, but that's something we can certainly look into. But theoretically, it should be safe, and pregnant women are one of the highest risk groups for COVID and severe COVID, and strongly recommend standard vaccination. But I haven't seen anything commented about the booster in pregnant women. I don't know, Dr. Taylor, I don't know if you'd seen anything on that specifically.
So there isn't any information on specifically with pregnancy and boosters, unless what you would want to do is, if you're already immunocompromised and you're pregnant, you would want to be truly evaluating whether or not that booster is necessary. I would tend to believe that you would still fall into that immunocompromised state, and so that they would likely still be recommending the booster for that patient population.
For certain women who are at high risk, it's certainly worth a conversation with your physician, I would say.
There's a question talking about, does vaccinating people during a pandemic cause the virus to mutate faster? Again, this is misinformation. And this is why I encourage everybody to not get your information from Facebook and from posts that your friends do on Facebook. That is not reliable scientific information, right? And it's just you can almost common sense this, right? Is where the virus mutates is when it has high viral loads in people who become infected, right? That is currently happening amongst the unvaccinated folks in our community, who are much greater rates of infection and higher viral loads in those individuals. That virus mutates because there's so much replication going on in their bodies. And every once in a while, there can be a mutation that's more favorable to being more contagious or more severe disease that can get passed on to another individual, and then it can spread. That's what's happened with the Delta variant and others. But that ability for, like Dr. Taylor already spoke about this earlier today, that happens in those individuals who have not been vaccinated and catch COVID, have high viral loads and high replication going on in their bodies. It allows the virus to mutate.
Thank you for that explanation.
Will protect against that.
Yeah. Thank you. So we're about to close out, and I just wanted to offer the panelists, if anyone on the panel would like any closing remarks or something we didn't cover tonight, I'll give you a moment to see if there's something you'd like to add.
I'd like to just give a real shout out and a thank you to all of our caregivers, part of our care team here at Mary Washington Healthcare. And they've we've talked about this before. We've talked about it for months, unfortunately, right? The strain that they're under, right? And the demands that they're under caring for our community. It's never been greater than it is now, right? And I want to thank all of them for everything that they're doing for our community to make everybody healthier. I want to thank all those other members for our care team that are pitching in, doing extra shifts, shifting their work to come over and help out. There's a lot of that going on now. Auxiliary staffing pools and other things that we're doing where everybody is pitching in and doing their part to help out at this time of great community need. And I'll say to our community, we're here for you. We're here for our community at times of need. We're not going on diversion. We're not doing those sorts of things, even though we're under extraordinarily stress. Where is there to go, right? Like we need to be here for you. And we're doing things like making those hard decisions about trying to say, you know what, we can't do every scheduled procedure that we'd like to do right now. We need to create this capacity for our community at a time of need. We'd rather be doing those sort of things, but no, we're going to be here for our community. But it's all of our care team that's allowing that to happen, us to be here for our community, and everybody's going above and beyond. They are heroes. I appreciate all the hard work that our care team is doing and their dedication to our community at a time of need.
It truly is a time to be MWHC proud, which we see on our social media feeds quite a lot. So thank you all to all of our, yes, thank you to our panelists. I appreciate the time you spent with us this evening and answering the many questions coming in from our community. And thank you to our audience, of course, for tuning in to this community town hall. We always like to put up information about vaccine clinics. The Rappahannock Health Department's been doing vaccine clinics. You can also go to vaccinate.virginia.gov or vaccinefinder.gov to find a location where you can do a walk-in clinic or a scheduled appointment to get a vaccine. If you've missed any of tonight's town hall, we do encourage you to watch the recording on our Facebook page or on our YouTube channel, MWHC Connection. Of course, if you're having any symptoms, we've talked about it. Dr. Taylor mentioned it earlier. We have these HealthLink nurses who want to help you. Our HealthLink nurse advice line can be reached by calling 540-741-1000, and they can help you decide whether this is something you might need to watch at home or when you need to get extra care. So thank you, and share with your friends and family the recording from tonight. So much good information. Thank you. Please stay safe and healthy and have a good night.